On behalf of the Centers of Medicare and Medicaid Services, the Administration on Aging, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Julie Cahoon, and I work for Kaufman and Associates. I will be the moderator for today's webinar. Before we begin, I'd like to highlight the main features of your webinar interface. First is the main window where you can see the PowerPoint slides. To the bottom right of the window is the Q&A pod. You can enter a question for our presenters at any time in the Q&A pod. However, today's question and answer period will be at the end of the presentation. Just above the Q&A pod is a Files pod where you can download a copy of today's presentation slide set. To download, click on the file name to highlight it, and then click on the Download button. Also, please note that all hyperlinks shared throughout the presentation are active and clickable. If you do click on a link, it may pull up a new browser window. To return to the webinar, minimize the browser window. If you need technical assistance during the webinar, please enter your tech support question in the Q&A box. Our tech support staff will be monitoring these questions throughout the webinar and will work to answer your tech support questions right away. You will receive an answer in the Q&A box. Finally, please be aware that today's webinar is being recorded and that the recording will be made available online in the near future on cms.gov. With these announcements made, I'd like to welcome everyone to today's webinar. Today's webinar is titled Navigating the LTSS Technical Assistance Center. Our presenters, Jonathan Collins and Katie Terra. Jonathan Collins is a project manager at Kaufman and Associates with a background in public health and community health education. He's a project lead for the Centers for Medicare and Medicaid Services contract. As a member of Kaufman and Associates Research and Evaluation Team, Mr. Collins conducts research for emerging LTSS topics and resources for tribal communities. Katie Terra is a technical writer at Kaufman and Associates. She provides writing and editing for the LTSS Technical Assistance Center and the LTSS Newsletter. Ms. Terra was a project lead during the 2015 redesign of the Technical Assistance Center. She will be listening carefully to your feedback today to see what changes or additions we might make to the website in the future. Thank you both for taking the time to join us today. I will now turn it over to Jonathan Collins for an introduction to today's topic.
Thank you, Julie, and good afternoon, everyone. I'm looking forward to presenting to you on the Technical Assistance Center. So a little background on the Technical Assistance Center. The Long-Term Services and Supports Technical Assistance Center guides American Indian and Alaska Native audiences in planning and implementing programs to care for their elders and people with disabilities. The TA Center contains LTSS resources for Native communities, especially health planners. The TA Center offers information on many topics related to LTSS programs, from planning steps to funding options. The TA Center was developed as a joint effort between partnering agencies, the Center for Medicare and Medicaid Services, Indian Health Services, and the Administration for Community Living. So now we're going to have a poll question for you. Have you accessed resources on the CMS LTSS Technical Assistance Center, and how did you use them? I see quite a few no responses. We hope after today you will be able to navigate and use all the resources that we have available for you. I do see a yes. That you share the information with other tribes interested. Thank you, everyone, for your responses. Now to give you a little background on LTSS. LTSS stands for Long-Term Services and Support, which is a range of health and social services that support elders or people with disabilities. These services help people live more independently by assisting with personal and healthcare needs and activities of daily living. LTS services can be provided in-home, in community-based settings, or in facilities such as nursing homes. LTSS programs are important due to the growing needs of tribal communities, specifically the elder population. LTSS programs improve lives, and these programs are able to meet the needs of these tribal communities. So now I'll turn it over to Katie, and she's going to lead us through navigating the TA Center website.
Thank you, Jonathan. So what we'd like to do next is we have a list here of some of the popular sections on the TA Center, some things we think might be useful to show you. So here in just a moment, I'm going to share my screen with you, and we're going to walk through some of those sections. Just briefly, what we're going to look at is we have a section for tribal leaders that provides information on LTSS specifically for tribal leaders. We have a new section that's LTSS focus areas, which presents LTSS research by category. We'll also look at the newsletter and webinars archives, and then information on financing LTSS programs. And the first thing we're going to do is go to the TA Center homepage. So without further ado, I'm going to share my screen. Okay, so this is the home page of the LTSS TA Center. And just wanted to point out a couple of things on here. Towards the top here, we have on the left the webinars and news section. This is a great place to just do a quick check of what the upcoming webinar is. You can see today's webinar is on there. And then it's also, you can go to the webinars archive or the newsletter archive from here, and we'll explore those in a moment. And then on the right, we have a newer section that presents, kind of highlights the latest LTSS research that we have. So as you can see, there's, webinar recordings, best practices reports, a lot of different things, and that's just kind of a sneak peek of all the research that we have. And then below that is the different main topic areas of the TA Center, which we will review with you today. So the first page that I would like to show you is the LTSS Newsletter Archive. I'm hoping that some of you might be familiar with the LTSS Newsletter. It is a great resource for news, funding announcements, webinar announcements. It has links to online resources for specifically for American Indian, Alaska Native LTSS programs. So it's really a great resource. It provides a good variety of LTSS topics for all types of tribal LTSS programs, whether it's tribal nursing homes, home and community-based programs. It includes information on Alaska programs. And, we have all kinds of information in there from tips for caregivers to, serving traditional foods in nursing homes, things like that. So there's a link at the top of the page here to sign up for the newsletter. I would recommend it if you haven't done so. You can also browse through past issues in the archive here. We have issues dating all the way back to our first edition of the newsletter, which was published about 3 years ago. And another great resource is the LTSS Webinars page. So you can, at the top of the page, it features information on the upcoming webinar. And then below that is the webinars archive. It has recordings of all our LTSS webinars dating back several years. And again, it just has a great variety of topics. Most recently, we did one on billing Medicaid for LTSS, just all kinds of topics here that are useful. And the next section I would like to show you is the financing section. So this is the landing page here for this section. It links out to 6 different pages, and we really have a wealth of information here on financing and funding tribal LTSS programs. The first 2 pages here, the financial planning steps and who pays for LTSS, those are kind of the foundational information pages. They talk a lot about what sort of considerations you should make related to financing and kind of help you really build up that knowledge base if you're just starting an LTSS program. We also have a page on working with your state, which it provides kind of some general steps for working with your state for LTSS reimbursements. The cool thing about this page, it provides specific examples of what other tribes have done in working with their state, so it's a great resource. Then we have a couple of pages specifically about reimbursements. We have a page on 100% FMAP, which is an approach to negotiating better reimbursement rates with your state and with the federal government. And then we have a page on comparing reimbursement rates. It discusses the different types of reimbursement rates that might be available to you and compares the differences between those. And finally, we have a page on grants and how those can be used to supplement other funding sources for LTSS programs. So just to give you a little sample of the information that we have in here, I would like to show you one of the pages, which is Who Pays for LTSS? And this page really just has a ton of detail on the different potential funding sources for LTSS programs. So that's Medicaid, Medicare, IHS, private insurance, out-of-pocket by patients, funds from the tribe, grants, et cetera. And it gives an overview. It shows pros and cons for each type of funding source. It provides links to more information. So there's really just a ton of information here on this one page. So this is, again, we have a lot of information on financing that's really helpful. So with that, I am going to turn it back over to Jonathan. He's going to walk you through a couple more sections of the TA Center.
Thanks, Katie. All right. I am going to start with the Tribal Leaders section of the TA Center. The Tribal Leaders section of the TA Center provides the tools and information needed to help start a conversation about LTSS within your tribal community. The voice of the tribal leader is critical in facilitating the discussion about LTSS. Whether it's just learning the basic information or if your community is ready to take action, tribal leaders and policymakers can find the information that they need here on this section. Under this section, you can also find under the long-term care for your community section, you'll notice 6 videos on the right-hand side. These videos were developed by Kaufman and Associates with specific messaging about LTSS topics specifically for tribal leaders. We've done videos on traditional foods, dementia and Alzheimer's care for tribal leaders, home-based care for elders and tribal members with disabilities, tribal support for caregivers, and video on financing tribal long-term services and supports. And after I conclude with the online demonstration, we're going to show you one of those videos. This section of the website also contains the Tribal Leaders Community Toolkit that includes brochures, fact sheets, and presentations on long-term services and supports in Indian country that can be downloaded. It also links to the LTSS overview section, a guide to how to use the Technical Assistance Center, and then examples of LTS programs that are currently in operation now. There are many different examples of tribal and urban LTS programs to review and learn from. So now I'm going to go on to the LTSS focus area section. As I mentioned before, there are many different types of long-term services and support programs and focus areas that cover the different needs of tribal communities. This page contains the research and reports that Kaufman and Associates has developed on these topics. So as you can see, KI has developed reports on hospice and palliative care, caregiver support, Native veterans, elder abuse prevention, tribal nursing homes, Alzheimer's and dementia, tribal foods, traditional foods, just to name a few of those topics. We work closely with CMS, IHS, ACL, and the Unite Group to brainstorm topics that are currently being researched, as well as topics that are of importance to tribal communities to focus on when developing these literature reviews, best practice reports, webinars, and our newsletter. Next, I'm going to take you to the Tribal Nursing Home Collaborative section. UNITE stands for Uniting Nursing Homes and Tribal Excellence. The UNITE group is a collaborative of tribal nursing home stakeholders who network, discuss best practices, promote evidence-based education and training, and work on quality improvement initiatives. If you scroll down through the website, on this page, you can find the conference call that the Unite holds, monthly conference calls. You can find the recordings from these conference calls, an overview of the tribal nursing home. You can find a directory of all of the tribal nursing homes. There's also a link right here where you can visit the Unite website to get more information. And you can even sign up for the mailing list. And then further down, you'll find the best practices reports for tribal nursing homes that have been compiled over the past few years. And then the LTSS webinars. On the emerging LTSS issues page, you will find literature reviews and best practices reports, which I'll go to now. Yes, on this section, you'll find the literature reviews and best practices reports that cover some of the LTS topics that I have mentioned before, dementia and Alzheimer's, adult family homes, we encourage you to take time to visit this section and download the best practices reports and literature reviews. This information can be beneficial to your tribe and organization that are currently doing work around LTSS programs. We've also done some best practices and literature reviews on disabilities and housing, as well as community-based services in Indian country. And to show you an example of one of the reports that we've done with the tribal nursing homes, we recently submitted this report in July on communicating with your governing board, and it was a report put together with information and interviews conducted with the Tribal Nursing Home Collaborative to find out about how they best communicate with their board and how they sustain that relationship. Feel free to go to the TA Center and download this report and others and read about them. So now I want to take the time to show you one of the tribal leader videos. This video, as well as the others, were all narrated by Stephen Paul Judd, who is a native filmmaker, director, writer, and a visual artist. So please feel free to check out the rest of those on the TA Center under the Tribal Leader section. Now I'm going to turn it over to Katie to talk about the additional topics you can find on the TA Center.
Thank you. Well, we have, in addition to the sections we just showed you, we wanted to do a quick overview of a few other sections that you can find in the TA Center. We have a planning section, program examples from other tribes. We have information on state and federal relationships and how those can help your LTSS program. We also have a searchable database of IHS, tribal, and urban LTSS programs. So we're going to talk a little bit about those. So the planning section is a great section for really all levels of readiness. It's great if you're just thinking about starting an LTSS program, but it also has a lot of good information for those of you who may have successful programs already and you may be looking to strengthen or expand them. We have the information we have for beginners. It kind of walks you through some of that financing information we looked at. Talks about the different program models, such as whether you'd like to do home and community-based care or a nursing home or other facility. Kind of gets you thinking about those foundational things before you get into the advanced planning. Then we have the advanced planning roadmap, which is a really great tool that walks you through 7 planning steps. And like I said, this can be for existing programs as well if you're looking to expand those. It starts with step 1 being a needs assessment, where you look at the needs of your community and resources that you may already have that you might be able to leverage. And then step 2 is setting goals, and then you complete all of these planning steps all the way through the implementation of that plan. And then the 7th step is actually program evaluation to ensure that you're meeting those goals that you set back in step 2. And this really kind of feeds back into step 1 of that needs assessment. That ongoing evaluation really creates a cycle for continually improving your program. So for that reason, we also provide in the planning section a ton of evaluation resources for evaluating your tribal LTSS program. And then we also have a program examples section. It highlights stories from real American Indian Alaska Native LTSS programs, including both facility-based care like nursing homes, as well as home and community-based care. It highlights reservation-based and urban programs, and it highlights tribes from the lower 48 as well as Alaska programs. And it has profiles that detail the approaches that other programs have taken and lists the services they offer. It also provides videos of some of these programs where you can learn kind of what worked for them, as well as videos where tribal LTSS experts are getting together and talking about what's worked for their program. So this is a really great resource for kind of seeing what others have done and seeing if that applies to your program. And then I'm going to turn it back to Jonathan to talk about the remaining couple of sections.
Thanks, Katie. So also on the TA Center, you'll find the state and federal relationships page. Working with state and federal programs can support your LTSS program and help ensure that program is sustainable. On this page of the TA Center, you can find information to guide you with connecting with state and national resources. So on this section of the TA Center, there are 5 major parts of this page. There's a state and resources map section, national and regional resources section, state Medicaid plans and waivers. There's a section on the 1915C waivers by state and national overview of the 1915C waivers. So under the state resources map, you can find state Medicaid agency contact information. You can find the details about state waivers, information on area health boards and regional tribal organizations. Under the national and regional resources, you can find information on different subtopics such as housing, veteran services, and Native American communities. Under the state Medicaid plans and waivers, that section can help break down the 1915C waivers, the 1915I waivers, and the 1915I self-directed personal assistance services. So the 1915C waiver section, it gives you the breakdown by state. And currently 35 states offer the 1915C waiver program, which allows states to provide home and community-based services for those that are in need of LTSS services. In this section, you can find out the types of services that may be covered and what groups of people may be covered. And then under the national overview of the 1915C waivers, you can find out what types of waivers are available nationally, what types of waivers are the most common, which states have higher and lower numbers of waivers. And then the last section that I'm going to talk about is on the database of IHS tribal and urban LTSS programs. So CHS, IHS, and ACL are the federal agencies that support the LTSS TA Center, and they are working together to help tribes and communities in Indian country build and expand their LTSS systems. On this section of the TA Center, you'll find information on for Centers for Medicare and Medicaid Services. You'll find specific for Administration for Community Living. You'll find information on Program of All-Inclusive Care, or PACE, for the elderly. There's links to Indian Health Service, specifically for long-term services and supports. And then there's national resources, and these resources cover many issues related to LTSS, from professional development assistance with specific aspects of LTSS. There's general resources from Aging Well in Communities, toolkits, the Center to Advance Palliative Care, home and community-based care services, resources for Native American communities such as the National Indigenous Elder Justice Initiative, National Resource Center on Native American Aging. And there are also links to the Tribal Epidemiology Center. And there are 12 tribal epidemiology centers that are funded by IHS. And some of these centers offer training and technical assistance or other services to help American Indian Alaska Native communities address their health issues. And on this TA Center, it lists the 12 tribal epidemiology centers. And you can also find specific programs by location or a certain service offered. And now we're going to go into our second poll question. What topics would you like to see featured on the CMS Technical Assistance Center? We are always looking for new ideas and new topics to cover, from our literature reviews to webinars to information to put in our newsletters. So this is the time for you to let us know what you'd like to see.
And to respond to the poll question, simply type in your response to the box directly below the question.
Great. So the first is certification processes, trends, and challenges. OHCDS model. Any others? Feel free to write in any of those that come to mind. We are very responsive to the recommendations that you provide us, because you all are the ones in the community doing the work, so we'd like to hear from you. And someone says perhaps connecting with other individuals who have experience navigating state systems. Thank you for that. Training on all the categories that are issued on the patient eligibility. Okay. Well, great. Thank you for those responses. You can always feel free to email us at ltssinfo@kaufmaninc.com and submit other ideas that you might have. Again, that was ltssinfo@kaufmaninc.com. We have one more poll question. What resources shared today on the CMS LTSS Assistance Center appeared most useful or interesting to you, or the work that you do? Some responses. Tribal governance, great. The visual navigation on the CMS LTS website was helpful. Great. We're glad that we could provide this information for you all that you can take back to your organizations and use. Navigation was very helpful. Great. Information on getting started with LTSS and funding sources. The links to the state waivers information. Great. Thank you all. If you all have any other questions, you can also contact the Centers for Medicare and Medicaid Services. Their email is listed, tribalaffairs@cms.hhs.gov. And then we've also provided the link to the long-term services and support PA Center here. So again, we thank you all very much. Please feel free to check this website out and use it as a tool and resource for your tribal communities and organizations.
All right. Thank you, Jonathan and Katie, for that presentation on the LTSS Technical Assistance Center. At this time, we'll go ahead and make make room for some questions. So if you have any questions for our presenter, please enter your questions in the Q&A pod located at the bottom right side of your screen. Okay, and we'll just give a few moments for folks to type in their questions. Again, if you have a question for our presenters, to go ahead and just type that into the Q&A pod located at the bottom right of your screen. Okay, so it looks like folks are pretty comfortable with the information that was provided today, so that's great. I would like to remind everyone that if you do have any recommendations or ideas for the Technical Assistance Center, if there's any topics that you would like to see featured on the website, to go ahead and email LTSS-info, and that's LTSS-info at kaufmaninc.com, KAUFFMANINC.com. And we are, as Jonathan mentioned, very responsive to any and all recommendations that come in. So again, I would like to go ahead and thank Jonathan and Katie for joining us today and sharing information about the resources available on the LTSS Technical Assistance Center. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and PowerPoint will be made available online at cms.gov on the LTSS Technical Assistance Center website. Thank you again for joining today's webinar. Our session is now concluded.